As a first year resident, whenever any mother, parent is giving you this slip, what is this? A printed sheet from the automated hemogram. Invariably, you will look into CBC. You will say, oh no, a total count is increased, neutrophilia is there, lymphocyte is there. But how many of you are looking into the other parameters? There are so many parameters. It gives you MCV, it gives you MCHC, it gives you RDW. Okay, this MCV, RDW, MCHC is going to give you so many fancy diagnoses. You need not do a ferritin to diagnose iron deficiency anemia. You need not do betal or methylmalonic acid to diagnose betal deficiency. You need not do bone marrow to diagnose bone marrow infiltrative disorder. Everything can be get with this simple one page printed from the automated hemogram. Okay, an increased MCHC 40 with the anemia, probably what? Hereditary spherocytosis or autoimmune hemolytic anemia. Simple. Okay, so what we are going to see, basically what we use is a 3-part counter. For a diagnosis of anemia, a 3-part counter is enough. Rest of the details regarding what is an automated hemogram is discussed in one another video. But here in this video, I am going to say a simple approach. Usually we do a 3-part counter. That 3-part counter will tell you what is the total count. In the total count, what is the new lymphocyte count, what is the neutrophil count, what is the mixed. Mixed contain other things. What are all other things? Eosinophil, basophil, monocytes. For identification of anemia, a 3-part counter which shows a lymphocyte, basophil and a lymphocyte, neutrophil and mixed, which contains others, is more than enough. But it gives me MCV, it gives me MCHC, it gives me RDW, it gives me hemoglobin, it gives me RBC number, it gives me whether other cell lines are affected. This is enough. A 3-part counter which costs around just 300 rupees is enough to identify almost majority of diseases that you come across, my dear children. Majority of diseases. So in the next part, sequel A, we are going to discuss about case scenarios. You have a prequel A in which we have discussed about an automated hemogram. So this is the approach to anemia based on the automated hemogram. For that, what do you need to do? Whether other cell lines are affected. Anemia means hemoglobin RBC number. But look how platelet is affected or not. Look whether your total count is affected or not. This is important because when other cell lines are affected, it can be peripheral destruction, or it can be due to bone marrow, or it can be due to hypersplenism. Second point, MCV. You all know that all cases of anemia is mainly based on microcytic, normocytic or macrocytic. RDW, red cell distribution with, you have CV and standard deviation. CV, coefficient of variation. Forget about this ST, standard deviation. Remember CV. 14.5 value, magic, but that is enough. RBC number, whether RBC number is high or low. Okay. So when I see a case of anemia, step 1, I will see whether cell lines are affected. Step 2, I will see MCV. Step 3, I will see RBC number. Step 4, I will see RDW. Pass. I will get the diagnosis. You will get the diagnosis at the end of this discussion. Okay. Right. Anemia basically is classified as a hemoglobin of less than, based on the age. Between 6 months to 5 years, a hemoglobin of 11 grams per deciliter. Between 5 to 11 years, 11.5 grams per deciliter. 12 to 14 years, again 12, less than 12 grams. Girls less than 12 grams. Boys less than 13 grams after adolescency. But by and large, predominantly anemia will be, nutritional anemias will be seen between 6 months to 2 years and during the adolescency period. So a cutoff of less than 11 and cutoff of less than 12 is more than enough.